chat box, or do you want to screen those for me, or what?
I'll take it from here. So we have a ton of questions that have been coming through in chat. I've been capturing those. I have like a full page of questions. Let me mute myself. And so I'll go ahead and ask those. But if you want to ask a question personally, go ahead and use the raise hand function. But I will go ahead and start reading off these questions. So first off, we'll start at the top of the list. So hospitalization patients are all tested. Is that accurate?
Yeah. So when you're hospitalized and you've got symptoms of COVID-19, there's plenty of testing capacity now. And so those specimens get collected, goes to the laboratory. The turnaround time is a huge difference. The turnaround time is from between 2 and 8 days. Now, how it could be 8 days, I have no idea, but I have heard that there are some hospitalized cases where the diagnostic test result doesn't come back for 8 days. But most of the time it's within 2 or 3 days. But yes, if you're hospitalized, you get tested. Not that it's 100%, because when you use the Q-tip swab up in the nasal cavity there, the idea is to get some of that RNA virus on the tip, and it's because it's both an art and a science to get that sample collected. Sometimes there are false negatives just because the swab didn't get enough RNA virus on it. But the simple answer is yes.
Okay. Black people are dying at a disproportionately high rates from the virus. How do we obtain statistical demographic data about COVID-19?
So what you described is true nationally. And the place that I would send you is the CDC's website. They do a report. They do a couple reports a week. They're called Morbidity and Mortality Weekly Reports, MMWR. So if you go to search CDC MMWR, you can pull up the CDC's website, and they often will do updates that include that kind of demographic analysis. From what I've read, you're absolutely right that African Americans that are at a much higher risk of having the kind of complications that end up ending badly in death or severe consequences. In our state, what the main health disparity that we see is with Native Americans, which I've already sort of talked about. But the short answer is go to CDC and look for MMWRs that update those demographics. Now, I will say that the data isn't great because when somebody gets a diagnostic test, the focus of the data that they collect has to do with the age, the patient identifiers, and even the payer source and that kind of stuff. Often the field that has ethnicity in it is left blank, and so it's one of the bigger uncertainties in with respect to the data is the ethnicity piece, because that's often missing, from the diagnostic sampling test.
Perfect, thank you. Next up, in what ways do elective procedures compete with COVID-19 cases for surgical resources?
So, so the original executive order from about a month ago was done for two reasons. Number one, because they believed that elective procedures would be using PPE, personal protective equipment, that should be reserved for use when the COVID-19 surge happens. And so that was a justification for the elective procedure ban in that executive order. Another part of it was to ensure that you weren't going to have hospitalized patients that were there for elective reasons when you would eventually need that bed for for a COVID-19 patient. But it was tied to both PPE and case and just hospital capacity. And so going back to the question, I think the competition that they were concerned about was really about PPE, but also ventilators, and beds. But again, it was made in an environment where a month ago it was pretty scary and really suggested that we'd be exceeding our capacity, which we know now is very unlikely to happen.
Perfect, perfect. What is your best estimate as to the timeline for when we'll be able to implement widespread testing, such as retesting frequently if needed, no rationing of testing, and so on?
The simple answer is I don't know. There's two major factors on that. It's you've got to have a good supply chain for the test kits and the transport media. There's global demand for those things. And so and everyone wants them, everybody needs them, every state, everyone from South America to Africa to the US. And so there's all global demand. So the answer is I don't know. But there are other people that are manufacturing these kits now. ASU, I believe, is making 1,000 a day. So it kind of depends on at least right now, it depends on the sampling kits. There appears to be adequate scale with respect to SnorQuest and LabCorp. And by the way, a lot of other hospitals like Dignity System, I don't know about Banner, but I know Mayo, their pathology labs are running their own tests internally. And so there's more and more capacity that's coming. But the short answer is I don't know when there'll be enough testing to allow us to do the kind of quick diagnosis and contact tracing that we'll need to responsibly loosen some of these social distancing orders.
Okay, all right. So there's several around mutation. There appears to be many strains. Does immunity to one source provide you immunity to another? How long do these antibodies last? Weeks or months? Yeah. So
let me talk about the immunity a little bit. So there's good news. Some of those questions we know and some we don't know. There are 8 strains that last I heard, which was last week. By the way, the folks doing a lot of this work are at TGen North, which is associated with NAU. There are 8 strains of the virus. And there's a whole field of virology where they can track the rate at which a virus mutates and then classify it as, a rapidly changing or mildly changing or a slowly changing virus. So far, and there's a whole algorithm they use for this. But while there are 8 strains, these are just mutations in the NRA or the RNA. The rate of change is slow, which is good, which means it's not like influenza, which has rapidly changing protein coats, et cetera, which is what tricks the immune system, which is why you need a different vaccine every year for influenza. So yes, it's mutating. There are some genetic base pair changes within the RNA. The good news is that the pace of genetic mutations so far has been slow, which is encouraging. It appears as though if you, once you're infected and recover, almost all RNA viruses are such that once you recover, you don't get the virus again. So that's another good thing. One of the other questions you had was, how long do the antibodies last? So in a nutshell, here's what happens in your body. You get, the virus gets into your body. It has a protein coat on that virus. Your body recognizes that as a foreign body, and it uses the protein coat as the mechanism by which your body makes antibodies that can attach directly to that protein, to the little nodules on that protein coat. And when the antibody connects to the virus, the rest of your immune system, it knows, oh, this antibody has connected to this virus. And so you have things called macrophages and other immune system responses that connect to that antibody. And then some of it is just, it's crude, really, in a way, where your macrophages just come in and destroy the whole area. So there's tissue damage along with destruction of the virus. And so, so that's how your body reacts. The antibodies that you have, one is called IgG. There's 2 kinds of, your immune system has 2 basic systems. One is antibodies. So that's the mechanism I talked about, where it's like a lock and key, where the antibodies attach to the virus. There's another piece called cell-mediated immunity. Those are T cells and B cells. T cells you heard about through the HIV, I'm sure. So your antibodies will be in circulation for, so this is a really good question. Your antibodies are in circulation for a matter of weeks, probably not months. They're short-lived because the IgG is your sort of emergency response immune system. Your longer lasting response is your T cell mediated immunity. And so, so that's when you do serological testing. One of the things to keep in mind is that you may be infected with the virus and recover, and do the antibody testing. And if you test a month after infection, you're going to find those IgG antibodies, and you'll test that, yes, you've had the disease and you recovered. But if you test 6 months later, it's going to be negative, and you still have immunity to the virus, but the antibodies will be gone, because your body only makes the antibodies when it thinks it's going to need them. But your memory, your immune system memory is still there with the T cells. And so when you're exposed again to the virus, your T cells and your B cells recognize it right away, and your immune response is very fast. And that's why you don't get sick again.
Okay. I'd like to ask about several of the treatment options. There was a doctor from New York claiming that it should be treated as high altitude sickness. Ventilators are damaging people's lungs. Another comment about intravenous vitamin C treatments and a relationship between vitamin D insufficiency and respiratory infections.
Many of those tie to research that I haven't read myself, so I can't speak to it directly. I will say, with respect to ventilators, you're onto something there. Early on, I think 5 weeks ago or so, there was a sort of I think a general notion that ventilators were some sort of critical control point with our response. But the fact is that once a patient, sort of grade A saw like this, you go and you get hospitalized, and they might put you on a little bit of supplemental oxygen. And they may have to up that, and eventually you might even get to 100% oxygen with a CPAP or something like that. But once you get to the threshold of your oxygen levels not keeping up even on oxygen, and they start thinking about intubation and getting onto a ventilator, that's a really bad scenario. And I think the thing that I read was that of the people that end up on a vent, 40% of them die anyway. And one of the things you mentioned is about the lung damage, which is a true thing. Forced ventilation assaults the lungs, really, and you need to regulate it really carefully. And so it's not something that I think is the number of ventilators. There's been a lot of talk about ventilators. Ventilators is not, once you get to that stage, it's not like it's going to bring a whole bunch of people back. It gives people an opportunity to survive, but it's not a super effective treatment plan.
Wow. Okay. Thank you. Thank you. So talk a little bit about transmission. Massage therapist with a solo practice, clean and disinfect the room. What do you see as realistic personal protection measures to have? And then is it too risky to have 6 people together outside 6 feet apart? And then pools and transmission.
So I'll touch the pools I'll do first. It all depends on whether there's chlorine in the water. So bring your test kit with you, basically. If there's chlorine in the water and at least 1 part per million, then you're good. If people are swimming in a pool with no chlorine, it's reasonable to expect the virus could transmit that way. So it all depends on whether there's chlorine in the water or the hot tub or whatever it is. transmission in terms of distancing and so forth. One of the things that's so challenging about this virus is that there's so much asymptomatic spread. And that is people who don't know they're sick are carrying and shedding the virus to others. And so that's what makes this illness so challenging. One of the things that makes it so challenging. And so, it's just those basic things that make the biggest difference. Hand washing, paying attention to distances. If you have any symptoms at all, please don't go out in public or even be around your family members or your household, because that's what spreads the virus. There's nothing magic about the 6 feet. It's sort of 2 meters is something that people know as a distance. That's something that they can judge. I think it's more important. The hand washing pieces are, I think, probably as or more important than the distance pieces. With respect to the trade that you mentioned, massage therapy, I don't know enough about that to be able to talk about what the mitigation measures might be. But the general discussion ties back to, employment generally, which is, when the economy gets opened back up, which will probably start to happen in the coming weeks. One of the important things for any business, whether it's massage therapy or whatever, is to make sure that you've got some mitigation measures in place to protect the customers and the workers. And so I don't know enough about massage therapy to say what you could do. One of the things is, as antibody testing becomes more available, as well as diagnostic testing, I think, I was telling my daughter this, I think what's going to end up happening at some point is that people are going to end up having, like they can have a card in their wallet that shows that they had an antibody response to suggest that they've got immunity, and be able to document that and show it to others that they've got, that they have been, that they've recovered. And so let's say you have a massage therapist, as an example, that was positive for the virus and recovered and has antibody IgG. That would be something that they could disclose to their customers, that you don't have to be fearful, I've recovered from the virus. And so that it puts a different dynamic on that customer professional relationship when you can document that one or both of the folks has immunity to the virus.
Yeah, excellent. Is it possible that we will have a second wave of outbreak in the fall?
Yeah, I think it's likely that there'll be there'll be other waves, either maybe even later on in the summer or throughout the fall, and that's why the widespread testing and the contact tracing is so important, because you've got to be able to get diagnostic tests quickly and identify those cases, get them into isolation, find their contacts, get them into quarantine, so that you can stop sporadic cases from becoming larger outbreaks. Having said that, as we progress through this pandemic, more and more people would become infected with the virus. There may be, like the Santa Clara County thing I was describing, there could be far more people that are infected and recovered than we know about. And that every one of the ways to think about this virus is that it's continuing to vaccinate people naturally. So when you get infected with the virus, you're getting vaccinated, and you recover. And so fewer and fewer people will be susceptible over time, because more and more people will have become infected and recovered.
Okay. Paul, you've raised your hand. I'd like to go ahead and unmute you.
I thought you used this. Yeah. Oh, okay. Oh, okay. Oh, me. Okay, great. Yeah, there's people out there. Yeah, well, okay, I thought it was Paul. We're not communicating. This is what's happening when you live. You're just, it's, oh God, our relationship's falling apart. Okay, 3D printing. There's people around there printing PPE, and you giving it to hospitals, health, elderly care places, and things like that. I'd want to know if you'd heard anything about that. Is that something that's actually useful to do? I have a 3D printer, but it's not quite big enough to print anything useful, but I'm trying to get one, so I just thought I'd ask about that.
I don't know enough about it to answer that question directly, but when the supply of stuff is as short as it is, anything helps. So I got a personal story, kind of. So my wife has a little, not really a business. I wouldn't say it loses money. It doesn't make any money, but she employs people with disabilities to like stamp products, and then she sells them online. They're like plant bags and tote bags and stuff like that. And so she's able to pay people with intellectual disabilities to do this work. And she just shifted her product line to just cloth masks. And so she's cutting up her tea towels, which weren't moving as product. And now she's making face masks, cloth masks. And so she when she opens up her website, like if she makes 20 masks at night, that she opens her website for an hour, they're sold within a half an hour. So, but it goes to your point. I think every little bit helps, especially when you're in such short supply as we are. And I think every little bit helps. But I don't know enough about 3D printing to know, like, how that works and stuff.
So what would you like to see from an opening up or loosening of restrictions, and as a professional?
So the first thing I'd like to see is, and I hope this happens the coming week, but I'm not optimistic, is that the governor will loosen the restrictions on elective procedures. And so I've had a few media people ask me that this weekend, and I keep saying the same thing. I said, that's the first step. Because people are suffering unnecessarily, and it's creating a backlog of needed. Elective doesn't mean trivial. I mean, this is real procedures people need. And then on loosen the expectation that hospitals increase their capacity by another 25%. So those would be the first two things. And that would be, I think, where I would stop in April. And then the questions become in May. And so the question is, at the beginning of May, where are we with our surveillance? Where are we with our hospitalizations? Where are we with our testing capacity and our ability to do contact tracing? And if all of those things are looking good, then I think that there could be some relaxation of some of the stay home order, as an example, in a phased approach. And I think even by mid to late May, it would be okay to even open up bars and restaurants in a limited way. So, for example, one of the things that you could do as a mitigation measure at a bar or restaurant would be to say, at the beginning, we're asking you to open up at 25% capacity. And so if you were a 100-chair restaurant, and by the way, the county health permits for the restaurant inspectors, those permits all have the number of chairs on there. So this is something their compliance is possible. You could look at it and say, let's open up at 25% capacity and spread out your customers so that when the hostess or host does the seating, that they're spread around. And you could have your service personnel wear masks and so forth. And so I think there are things that you could do on scale for things like bars and restaurants, even by the end of May, if you do it in a thoughtful way. I wouldn't open up at 100% capacity right away, but that's where I would go. And then with respect to other businesses, it's really a matter of asking them to have mitigation plans in place. And if you've been out in the community, you've seen these mitigation measures. I went to AutoZone yesterday because my father-in-law's battery went bad, and I went to AutoZone, and they had even AutoZone, had blue tape 6 feet apart. There was you couldn't get close to the technicians in the back, and they were limiting the number of people that could go into the store. And then I had a plumbing leak, and with my evap cooler, and I had to go to ACE 3 times because I got the wrong stuff each time on the compression fittings. But even in ACE, they had social distance. So it's a matter of opening businesses in a thoughtful way with mitigation measures. But I could see that, short answer to your question, I could see us responsibly opening up things in May. And again, my motivation for this is it's important for the service workers. Low-income people are hurting badly. I'm going to be fine. Many of us on the call are going to be fine because we have the resources and we can make it through this. But I'm most concerned about low-income people in the service sector who are losing their ability to make a living, and it has having a profound impact. I think it's incumbent on us to get them back to work as soon as we responsibly can.
Yep. So there's still more questions, but we are at time. So I'm going to go ahead and call this section. I wanted to thank everyone for coming today to the HSGP Digital Sunday Speaker. If you have enjoyed the content, then smash the subscribe button, contribute to our Patreon page, or even better, become a member of HSGP and volunteer. I would like to thank you all for coming, and goodbye, all the humans. If you would like to stay after and ask Will questions, if Will's willing to stay after and answer a few of the questions, that would be great. And with that, we can go ahead and stop the stream.